One of the most common questions families ask me as a hospice nurse is, how will I know my loved one is close to dying? The truth is, the body often gives us signs in the final days of life, but if you've never seen them before, those changes can feel confusing, frightening, and sometimes overwhelming. So today, I want to talk you through the 12 signs of active dying, what they mean in the body, and what you can do to bring comfort during this time. Hi, I'm Katrina. I'm a registered nurse and the founder of Calm Endings, where education meets compassion to help families navigate the end of life. If you're here because someone you love is nearing the end of life, I want you to know you're not alone in feeling uncertain or afraid. Understanding what the body is doing during this stage can often bring a sense of clarity and peace. So that's why I want to go over what active dying is. Active dying usually occurs in the final days or hours of life, when the body really begins to start shutting down. Not everyone experiences every sign, and they don't always appear in the same order, but most people experience anywhere from 6 to 8 of these changes during that final stage. These signs are simply the body's natural process of letting go. Let's go over these 12 signs now. The first and most common sign of the 12 active stages of dying is less interest in food or fluids. So to me, this stage, from my experience, is probably the most concerning for caregivers. It's usually one of the first steps that's leading us in this direction. And a lot of times in our culture, we love to make delicious food for people, and we know that you're not going to get better unless you eat. So when our loved ones suddenly don't want to eat or drink anything, this can feel very alarming. But what you need to know is this, and I think Barbara Karnes, the guru of hospice care, says it best. We really need to transition from nourishing the body to nourishing the soul. So when our loved ones no longer want food or drink, we need to respect that, because at the end of the day, what's happening is the body is no longer absorbing that nutrients. Our organs are no longer working how they used to, and actually pushing food or fluid can cause more harm than good at this point. Their body's just not digesting the food and they don't need it. What we can do for them is give them mouth swabs, keep their mouth nice and moist, have lip chap nearby to make sure we're moistening their lips and keep their mouth nice and moist. And that's going to create comfort in itself, and really just be with them at this stage and transition something you've been doing like cooking into something different, like reading them a book, nourishing that soul. Number 2, sleeping more or becoming completely unresponsive can be one of the stages as well. They can still hear you. One of the things I want to stress is there's been studies that most clinicians truly believe hearing is the last thing to go. So they could go from sleeping, 15 to 20 hours a day to being completely unresponsive. Some people might still mutter the odd thing. Sometimes you'll still get hand squeezes from them when you're talking to them, but sometimes you won't get anything. And just know, because they're unresponsive doesn't mean that they can't hear you. So still talk to them, and still be present. I truly believe they can still feel your presence in the room. Number 3 is decreased urine output. So a lot of times, whether we've been changing our loved one because they've been in briefs or they've got a catheter, it can be alarming when we go all day and there's absolutely no urine. That's completely normal. As the body begins to shut down, so do our organs. The kidneys are one of those organs that will begin to shut down, and we can get absolutely no urine output whatsoever. Another thing we can see, which can be alarming, to be prepared for, is we can get really dark Coca-Cola-like urine or blood in the urine. And as the kidneys shut down, this can be normal. So don't be alarmed if suddenly there's no urine in your loved one's brief or catheter, or it's turning really, really dark and there's very little. That can be a normal process. So, still check to make sure that they're nice and dry. That's providing good comfort care. but don't be shocked if you need to change them a lot less because there's no urine being produced. Number 4 is cool hands, feet, or legs. So as our body begins to shut down, we're no longer putting a lot of warmth and circulation to our hands and feet. They can feel really ice cold. This is normal. Our temperature regulation sometimes is thrown off at the end of life. I've seen patients who sweat a lot but have really cold hands. I've seen people who are really hot and then really cold. You know, their temperature regulation kind of fluctuates. So just keep the room at room temperature. And, you know, if they feel cold, add blankets. If they feel warm, remove the blankets, add a fan. You know, do what you think would make them comfortable. But at the end of the day, no matter how many blankets you add, sometimes their hands and feet are still going to feel very, very cold. Know that there's really nothing you can do for that, and just know it's part of the process. Number 5 is mottled or blotchy skin. So as we're not sending as much good circulation to our hands, feet, and legs, we can end up getting these kind of like veiny, blotchy, bluish, vein-like spots on the arms and legs. And it can be concerning because it doesn't look pretty. It can be really blotchy and blue. And that's just circulation slowing. And at the end of the day, there's really nothing you can do for it. We can still, you know, sometimes this process can be last days, not just hours. So just make sure we're still turning our patients, positioning them, repositioning and moving their hands, because with no circulation going to those extremities, we can have a little bit faster skin breakdown. So just make sure we're propping that and doing that for them. Number 6, changes in bowel habits. So just like urine, we can have changes in our bowel and bathroom habits. So somebody who might have been continent and going to the bathroom can become incontinent. Sometimes there can be constipation, so there might not be any stool. But sometimes, a lot of times, as all of the muscles relax in the body, we do have incontinence, and sometimes it'll happen with oozing. So we'll kind of have stool oozing consistently. So just be prepared for that. And just the best thing you can do is just make sure that they stay clean and check often. And don't be alarmed if there's nothing either. So it could be constant oozing, a little bit of oozing, a lot of incontinence, or nothing at all. So that can really fluctuate from person to person. I think it depends on how they've been eating up until this point, about how much stool there's going to be versus probably hardly anything. Number 7 is restless or picking at the sheets. So sometimes our patients, when they're going out, our loved ones are starting to leave. As our body shuts down, there's a scientific explanation for this in the sense of our liver's not breaking down chemicals like it used to. So those buildup of chemicals can affect our brain. We're not getting as much oxygen to our brain as we used to. So the oxygen levels can affect our behavior as well. So sometimes we'll have lots of agitation and picking at sheets. And if this is happening, what you can do is you talk to your healthcare team about it. Talk to your hospice nurses, talk to your doctors. If it seems like they're extremely agitated, there are medications they can give them to help calm them down. A lot of times people can even hallucinate with this agitation, and the medications will help with that too. One of the things that I don't believe is really medically related that I find happens, which I find it brings a lot of comfort to families, is they'll start to see and talk to loved ones who have passed. Some people might think of it as hallucinations for what's going on in the body. I truly believe we don't depart this world alone, and it's our loved ones who have passed before us coming to greet us and see us. So don't be alarmed if that happens. Sometimes it can happen a week or days before the person passes that they're seeing these loved ones and communicating with them. I think it's a lovely, peaceful part of the journey. Number 8, slack jaw or facial changes. So a lot of the times as our muscles in our body relax, our muscles are actually always being used to hold our jaw and everything in place. But as those muscles are relaxing, a lot of times jaw is going to prop open and our facial expressions and how we look changes right towards the end as well. There's nothing really you can do about it. There's nothing you need to do about it. Just be prepared that that's something that can happen. I've seen families go ahead and, put pillows under the jaw to keep it closed, or wrap something around the chin and tie it up to keep the jaw closed. There's nothing wrong with doing that. Just know that it's for you, not for them. Their muscles are just relaxed. Number 9, noisy breathing or the death rattle. So the death rattle sounds like this big alarming thing, and this sign can probably be one of the more distressing things for families and patients, but knowing about it and being prepared that it can happen can help you understand what's going on. So a lot of times our secretions, so our saliva, everything that's in our mouth, we use our muscles to swallow it. But when our muscles are all relaxed and we're not swallowing, those secretions are going to pool at the back of our throat. And so when we're breathing, it can have this really rattling, gurgling, almost choking sound to it. The patient is not choking. They probably can't even feel it or sense it at all. So know that your loved one is not in distress. It doesn't sound pleasant though. So there's a few options. We can, ask our team to have suction. If you're in the hospital, a lot of times the nurses will go in and suction those secretions out. Another simple thing we can do at home is reposition the patient. Put a couple pillows or elevate the bed, turn them to their side. That can help pretty quickly with that gurgling sensation, that sound. Another thing you can do if it's really bad and it's starting to be there often is you can ask your team for medication. So they can give something like scopolamine, which is just a patch on the back of the ear, and that helps dry up those secretions. So there are medications for it that you can ask for. Number 10, a sudden surge in energy. So for me, I've experienced this actually very little for most of my patients, but it usually happens days before, not hours, but I have heard it happening even a couple hours before death. But patients get this sudden burst of energy, and it truly does feel like a miracle. They are sitting up, they're talking, they might even want something to eat. And you're like, what? I thought they were leaving in a couple hours, and now they're back with us. So what I say when this happens is it is a miracle in the sense of enjoy that lucid moment you have with them. It's probably going to be very short-lived, minutes to hours. Let them have or do or say whatever they need to. Be present for it. Know that it's probably that energy burst and it might go away quickly. So that's just something to be prepared for. I like to explain this to families so they don't get hope. They don't have false hope when this sudden energy surge does appear. Number 11, irregular or shallow breathing. So this is definitely a more common sign when our breathing becomes labored or uneven. Some people even explain it as breathing like a fish out of water. And their mouth is going and their chest is rising really quickly. That's a sign. It can be uneven, one breath, a whole bunch of breaths, one or two breaths. Everybody kind of does this irregular, shallow breathing a little bit differently. There is really no pattern. Everybody does it however their body is going to do it. It can be distressing to witness for some. What you can do for the person at this point is medications. Give more morphine if you have it for pain medication. Talk to your providers. Ask them what to give and what to do when this breathing episodes occur so you can make sure that the loved one is comfortable. And number 12 is long pauses between breaths. So a lot of times we go from that irregular, shallow breathing to really long pauses. So they might take a breath. It might be 10 seconds, which feels like an eternity. They take another breath. And sometimes they can last even up to 30 seconds to a minute, and then they start breathing again. This really is number 12 because it usually is the final stage. When this happens, eventually there'll be a long enough pause where there's one breath, and then that pause stays. It doesn't come back. your loved one has passed. There is no right or wrong way to respond when they've taken that last breath. Hopefully, your hospice or care team has prepared you. Hopefully, you have had a beautiful end of life plan prepared. So this is a calm process for you as the loved one. But no matter how prepared you are, the grief is still going to be there. So respond how you need to, what you feel is right. Culturally, how you and your family are going to respond, but just be present in that moment and know that your loved one is now at peace. Watching someone go through these changes can be deeply emotional, but just remember, these signs are typically not painful or distressing for the person. They are simply the body's natural process of beginning to shut down. What matters most during this time is your presence, your calm, and your love in the room. And as I've shared before, you can prepare and educate yourself about this process, and that preparation will help create a calmer ending. But even with preparation, the grieving process is still very real, and it can be incredibly difficult. If you're navigating this stage with someone you love, I created a free guide that walks you through these 12 signs of active dying and what you can do during each stage. You can download the 12 Signs of Active Dying booklet for free using the link in the description below. And if this video has helped you, please like and subscribe to the channel for more education and guidance about the end-of-life journey. And most importantly, I want you to know that you are not alone in this, and I'm here to help guide you through it.